not unusual to hear people say that they were deliriously happy. And whilst I'm really pleased that something is so positive has happened to them, that they feel this way, they probably don't mean that they were actually delirious with happiness. You see, delirium is a medical specific term, and it's one of those things that we have to do with medical students, to take words in common parlance, such as delirium, and explain to them the medical definition. So a delirium is an acute confusional state, often following an infection, and it's characterized by issues with cognition, issues with consciousness, issues with attention, and issues with perception. So that could mean that a patient is having issues with hallucinations. It might mean that they're not focused on things. It might mean that they can't stay awake, or it might mean that they are confused in their thinking. Ultimately, a delirium is a very unpleasant, frightening symptom to experience. And there are three subtypes of delirium. We can have a hyperactive delirium, often associated with those hallucinations and coming with it with agitation and a lot of distress. But we can have the opposite side of that. We can have a hypoactive delirium, and that's often where the patient becomes obtunded, their concentration and consciousness is reduced. They might have reduced appetite or not even engage with food. And obviously we've got a final medical school one which is mixed, where you've got bits of the hypo and hypoactive delirium. But the point is, delirium is a really severe, unpleasant, frightening symptom for patients. It can be triggered by a simple urinary tract infection, and I've seen patients be terrified about spiders coming out of the walls and things because of a simple infection that for the vast majority of people is an irritation but is not a major problem. So that's the real medical definition of delirium. Hopefully this has been useful in clarifying that difference there, and I'll see you in the next one. Take care. Cheerio.